Hi, my name is Owen Atkinson of Dairy Veterinary Consultancy, and this is the fourth and final in a series of short presentations looking at milk PAG testing for pregnancy. And this is about the practicalities. What is the best way to use the milk PAG test on my farm, or in fact, if you're a vet or other professional, on your client's farm? Just bear in mind, I guess I should say here, there are several different Alertys pregnancy test types which are suitable for different farm scenarios. And this series of presentations has been concentrating on the milk test. There is a blood test available as well, so bear that in mind. For example, if you're wanting to pregnancy test species such as bison or buffalo, or in actual fact suckler cows, where the milk test is probably not as practical or as convenient as the blood test. However, just concentrating though on the milk test and how that can be used in dairy herds, it does make sense to make use of milk samples which are collected at routine milk recording and have these tested through your milk recording organization. And this is certainly true for all farms that are having regular herd milk recording. That's the most logical thing to do. I'll just say at this point a couple of things to be aware of. Now, one, or probably the most likely reason for having errors being introduced in using the milk PAG test is mixing up of samples. If you put the wrong number on the pot for the cow, it's not going to correspond, obviously, correctly when the milk test is used for pregnancy diagnosis. So that is the thing to watch out for. Another potential, but this is less likely, but another potential error that can be introduced is cross-contamination of milk. So in other words, if you are collecting milk sample from a non-pregnant cow and that milk sample pot is contaminated with milk from a pregnant cow that has got significant PAG levels, then there is the potential for a false positive result in that non-pregnant cow. I say it's less likely than mixing up of sample pots or identification, and that's simply because even when you have very high PAG levels in a very established pregnancy, you're needing in the region of 10% of the milk to be contaminating in that non-pregnant sample, more than just a drop or so, but be aware of it and please be careful in how you're taking your milk samples. Now, one advantage of using milk samples for pregnancy testing actually makes it simpler than when you're taking milk samples for milk composition sampling, is that you don't need to take a composite sample. In other words, you can just take the milk from one individual quarter and that's okay. And it doesn't matter equally whether that milk is fore milk or mid-flow milk or end of milking milk. It doesn't matter. So you can hand collect your samples just by taking some draws of milk from one particular quarter. That is okay for when used for milk PAG pregnancy testing. Wouldn't be okay for constituency testing, so butterfat protein, cell count, BAT scan, etc. But it is perfectly okay for the PAG test. So let's look at a couple of scenarios, and we'll look at scenario number one. This is the all year round calving herd. And if you're using monthly milk recording, then continue to use your monthly milk recording for selecting cows for PAG pregnancy testing. Now, you could just choose to do the pregnancy test once a month, in which case you would be asking your milk recorder to do a pregnancy test on cows that were at least 28 days served. And if you're doing a milk recording every 30 days or so, it's going to be between day 28 and day 58, isn't it? That's the kind of window at which you'll be doing the majority of your pregnancy testing. However, because you want to take advantage of early pregnancy testing, it does make sense for a lot of farms to increase the frequency of testing by sampling cows when they reach their testing window, and their testing window is any time after day 28 days after service. And you can do this either once between milk recording dates, so in other words, around about a fortnightly interval, or for larger herds, it would be worthwhile taking milk samples every week from cows that are between day 28 and day 35, because it's a very reliable test for this window, day 28, day 35, and it's going to enable you to do very early pregnancy testing on all of your herd and get the maximum value out of early pregnancy testing, the maximum economic value. In any case, when you're using early pregnancy testing, I personally do recommend doing a confirmatory test on all positive cows which have been served for 11 weeks or more. And that doesn't need to be done on a regular basis. That can be just done once a month, because it's not so important to get that test done in a timely manner. And it's just a matter of asking your milk recorder to do a confirmatory test on all cows that are 77 days or more post service. You only need to do it the once, so each cow only needs one confirmatory test. You don't need to keep confirming each confirmatory test each month. So you'd be looking at cows between day 77 and day 107, that 30-day window for the confirmatory test. And there's been some UK studies that have shown that even herds that have a very low rate of loss of pregnancies after their initial confirmed pregnancy test, so even if you're looking at a 2% pregnancy loss from the initial pregnancy test, the UK study showed that it is economically beneficial to do that confirmatory test just to find that 1 in 50 cows that turns out to be empty. And remember that 1 in 50 cows losing pregnancy is a low number compared to the average. So depending on when you do that primary pregnancy test, if you're doing it early, round about the day 28 to 35 mark, then there have been other studies that have found that actually around about 15% of those cows won't go on to have a full-term pregnancy. So detecting those with the confirmatory test is definitely going to be value. And you may have a feel yourself for what type of farm you are. So if you're a farm who perceives a relatively high proportion of cows are returning to service after they've been scanned in calf or diagnosed in calf by another method, then it is going to be more valuable to do the confirmatory test. Now, moving on to scenario 2, block calving herds. So again, whether or not you're doing a routine monthly milk recording, a lot of block calving herds don't. They may do a seasonal milk recording. It makes sense to organize a milk recording date at 49 days after the start of your planned mating, because that is the good time to do your first milk test. Because what that means is that you'll be doing, you have the opportunity to do a pregnancy test on all cows that were served in that first 21-day cycle, and you're just waiting another 28 days, which is why it's 49 days after you're doing the milk test, 49 days after the start of planned mating, and you have the opportunity of getting a very, very quick and very accurate pregnancy diagnosis for that first cycle, which is fantastic because you're going to know how many cows are going to calve in your first 3 weeks of your block. Now you can continue to take weekly samples for larger herds, maybe fortnightly samples or even monthly samples for smaller herds, and sampling again any cow that is more than 28 days post-service that hasn't been served again and that hasn't already been diagnosed as pregnant or not. If you are a block calving herd that, as commonly would happen, you do 3 cycles or maybe only 2 cycles of artificial insemination before adding the stock balls, then it kind of makes sense to do a test 28 days after the stock balls have been introduced. Because again, if you do your pregnancy test at that stage, you will know which of your cows are in calf to AI. So this is 28 days after the stock balls go in. Do a herd pregnancy test and you will know which ones are in calf to AI. And that is going to give you very accurate pregnancies to your 2 or 3 cycles, depending on how many cycles you continue to do AI for. Then run the bulls And 28 days after the bulls are removed, do your final pregnancy test for all remaining cows that were not already found pregnant. And that will pick up your bull pregnancies. It won't age them for you, but that won't matter. It doesn't matter for most block calving herds. They just want to know which cows are in calf to the block. And you can always scan those tail enders to find out if it depends how long you leave the bulls in for, and when you choose to do your final milk test, you can always scan them to find out whether they're going to calve in the block or not. And in a similar way to the all year round calving herds, it does make sense for most situations to do a confirmatory test. But for block calving herds, probably that confirmatory test can come at any time pre-drying off. Their fate has been sealed, if you like, once the bulls have been removed for most farm situations, the block calving. So a confirmatory test pre-drying off will just ensure that you're not drying off cows which, for whatever reason, have lost their pregnancy and are no longer in calf. Now, where does this leave the vet? Well, I'm a vet myself. I'm a dairy vet myself, and I am a strong advocate of dairy farms having a good, close relationship with their vet. Still make use of your vet. What the milk PAG pregnancy test will allow dairy farms to do is to reduce unnecessary scanning of cows with the vet. And it also reduces cow segregations. That's good for you and it's good for your cows. And it's probably also good for your vet as well, if that then allows your vet to focus on the non-seen bulling cows, the PD negative cows, pre-breeding checks, maybe targeted towards those cows that are likely to have uterine disease, and fertility data analysis. So in other words, it's a more focused use of your veterinary time rather than just rectaling cows that could be tested via the milk test. So in summary then, make use of milk recording samples for sakes of simplicity, but don't feel that you need to just stick to milk recording times. More frequent testing means that you're going to get earlier pregnancy diagnosis for more cows. Taking those milk samples between milk recording dates is a very simple thing to do because remember, it doesn't need to be a composite sample. Tailor the testing to your herd type and your herd size. So larger herds, definitely you're going to be wanting to do pregnancy diagnosis as often as possible. So weekly for large herds, at least fortnightly. And remember, whatever your farm type, if you are using early pregnancy diagnosis, and by early pregnancy diagnosis, I mean between day 28 and day 45, then a confirmatory PAG test after 11 weeks has been found to be cost effective, whatever method you're using for that primary pregnancy test. So I hope you found that useful. What's a little bit of thinking about is the milk PAG pregnancy test. It's reasonably new technology, but it is tried and tested. I hope these videos have helped you understand a little bit more about it, a little bit more about where it can be used with confidence and whether it's suitable for your situation. Thank you very much.